Hi, I'm Jeanette Reynolds, and this video is a video I wanted to post to explain my new role as an infection preventionist and what exactly it is that an infection preventionist does. According to the Centers for Disease Control and Prevention, which is also known as the CDC, about 1 in 31 hospitalized patients unfortunately pick up a nosocomial or a hospital or healthcare acquired infection during their visit or during their stay or as a result of the care that they receive. And about 75,000 patients die unnecessarily each year because they went in to get surgery or to be treated for something, and in the process they got or acquired a nosocomial infection. It could have been MRSA, it could have been a virus, it could have been a multi-drug resistant organism, but whatever the case, they have picked this up in the clinical setting. Because HAIs, which are healthcare associated infections, are a threat to patient safety, which includes you and I, because we go in for annuals, we go into the doctor when we're sick, we have surgeries, we have friends and family who may need health care services. So many hospitals and healthcare facilities have made prevention and reduction of infections a top priority. And we do this through patient education, through family education, videos like this, pamphlets, putting hand sanitizers everywhere that are touchless so that when you put your hands under them, the soap comes out, the hand sanitizers come out, cleaning those spigots, and improving cleaning standards. I mean, even behind things like mirrors and ceiling tiles and behind pictures and things where stuff could stay hidden. Infection preventionists are healthcare professionals that make sure that healthcare workers and patients are doing what they need to do to prevent infections and also to prevent carrying infections to other people as well. Many infection preventionists are infection control nurses, infectious diseases doctors, and physician assistants, but they can also be epidemiologists, public health professionals, microbiologists, and medical lab scientists like myself, or other healthcare professionals who work to prevent germs. And that includes, as we've learned, when you took biology or A&P or medical terminology or microbiology or pathophysiology with me, then you've already learned about all of those germs, parasites, fungi, viruses, bacteria, and other things that we want to prevent those from spreading throughout healthcare facilities in a number of different ways. We look for patterns of infection within the facility, observe practices, which includes hand hygiene. Remember the glow germ lab, making sure that those hand washing and hand sanitizing, cleaning, disinfecting procedures, aseptic technique, and especially following that in the surgical area are followed. And we get to do presentations and clinical education for healthcare teams, for students on clinical rotations, for new employees, and we advise hospital leaders and other professionals. We compile infection data or statistics. So we're analyzing data and reports, we're entering it in, and developing the policies and procedures that help keep people safe and protected from infection. We also coordinate with local and national public health agencies at the community, the state, the United States federal level, which would be the CDC, and at the world level, which is the World Health Organization. There's also some other agencies like the National Institutes of Health and other names that I'm sure that you've heard of as students when you have been doing your research. There is a website to learn more, and I attached that to my website, but some of the goals of patient safety, which is our number one priority, that always comes first and foremost. So the role of an infection preventionist is to ensure that healthcare workers wash their hands. According to the CDC, on an everyday basis, this should be at least 30 to 60 seconds or to the tune of the happy birthday song. And if you remember from the glow germ lab, you are washing under your fingernails, between all those crevices, front and back, between your fingers, your wrists, the creases, a little bit up the arms. And then in surgery, those who are working in surgery, they go through more extensive procedures and perform specialized surgical scrubs, which last longer and they're a little bit more detailed, and the things that they use are a little bit stronger. We also make sure that the healthcare workers, including myself, we make sure that we get the proper and needed vaccinations and keep record of those things. We also work with doctors and pharmacists, which provide you as a patient with the appropriate antibiotics you need if you have a bacterial infection, an antiviral for viral infections, if you need that at all, and an anti-helminth if you have like a parasite infection, or anti-protozoal. Those are all under the big umbrella of antimicrobials. They can be pills, they can be IV solutions, they can be creams or topical solutions. It includes saline washes, and all of those things are highly monitored, and the dose varies by age and weight and per individual. Also, it's monitoring catheters and indwelling devices. This could be a urinary catheter, it could be an IV catheter, it could be a catheter in the heart, anything that's placed on the body, and making sure that the skin is being properly disinfected and kept clean, and that the catheter is removed as soon as possible. Also making sure that safe injection practices are followed at all times. Things are being put in the right sharps containers, that they're properly filled, sealed, disposed of, and documented and labeled and that sort of thing. Also, making sure that healthcare workers are wearing proper PPE, which is personal protective equipment, and that includes your gloves, lab coat or gown, masks at the right times, and shoe covers, hair covers, all that sort of thing, depending on the area and the situation. Making sure that the patient's room and any equipment that's going to be used is thoroughly cleaned, that it's documented, it's functioning properly, that it has been put in for repair if something's not working properly, and just making sure that all of that is documented. It also involves precautions and making sure that if a person needs to be on special precautions, isolation, that their room is prepared as such, they're in the right area, there's a sign on the door, family members and healthcare workers follow the proper procedures coming in and out of the room, all those sorts of things, and then making sure they're removed from precautions as soon as possible when they are cleared to do so. So it involves all of those things. And each of us, as a healthcare professional, patient, family members, all play an important role in preventing infection. Learning about infection preventionists and the infection prevention tasks and the basics will help patients and their families and everyone stay healthy while they are receiving health care. The top 10 ways that you and I as individuals can help prevent infection are speaking up, advocating for yourself, for your family member, for your care, especially if you see something strange or you see something that you have a question about, see something that is an unsafe practice. Always talk to your healthcare provider about that. Ask questions. It's great to ask questions, discuss your concerns. And whenever somebody recommends a treatment for you, you can ask why it's necessary, what are the risks associated with it, what is it for, and even make a list or write some questions down before your appointment so you don't forget anything. The second thing is wash your hands often with soap and water. That is the number one way to prevent infection. And this, of course, is called hand hygiene. Soap and water is always better than substituting with hand sanitizer, especially in the healthcare field. But if you're every day in your classroom, in your community, as long as you're not sick, um, most of the time, the hand sanitizers do kill most viruses, but I will tell you they do not kill norovirus, which is one of the most common vomiting, diarrhea, stomach bugs that goes around, especially in the fall and spring. And they do not kill spore-based bacteria, things like Clostridium difficile, which is more often found in the healthcare setting. So I recommend soap and water, and then you can enhance it by putting hand sanitizer on afterwards or in addition to that. But hand hygiene is the best way to prevent the spread of infection. Make sure everyone around you, including your healthcare providers and visitors, are cleaning their hands, especially after they've gone to the bathroom, before eating, if they've blown their nose, if they're about to touch you for an exam or anything. If you don't see that person using hand sanitizer first, or washing their hands, or putting gloves on, don't feel bad about asking them to do so, because healthcare workers are supposed to be educated to do this and to follow these procedures to keep you safe. Also expect that patients will and should ask them about hand washing, so we know to expect that. It's also important that you are diligent and consistent about washing your own hands when you're caring for yourself or a family member, and do it more often if you're sick. Number 3, ask about safe injection practices, especially if you or a loved one is getting a vaccine, a shot, getting your blood drawn. If you're diabetic and you need to give yourself injections, or you take the Ozempic injection, anything like that. There's always safe injection practices and steps that healthcare workers should be following, and make sure you pay attention to that. And also you yourself, if you are a caregiver, when you're giving an injection. Never, ever use the same needle or syringe twice. Most of these nowadays are easy to close, and they're always a one-time use. So never use it more than one time. One needle, one syringe, one time. Always remember that. Number 4, ask to have your room or equipment cleaned if you're looking around and you feel like it wasn't cleaned or cleaned well enough before you came in there. If you're looking around and you see oil or dirt on the table, the paper hasn't been changed, the floor looks soiled, you see blood or something on there, it's okay for you to ask about that, because that is extremely important for preventing infection. It's easy for germs to get passed on from surfaces, which are called fomites, to the hands, to a vector or carrier, and to other people. So it's okay for you to ask to have your room or equipment cleaned if it appears dirty or dusty. Number 5, ask questions about your medications. Using antibiotics incorrectly, or if you don't need them, stopping them early, taking too much, borrowing a family member's, giving yours away to a friend. This unfortunately can cause bacteria to survive and thrive and mutate into superbugs like MRSA. Know that your medication is for you, how to take it, how long you should take it. Follow those instructions exactly as they say, because there's a deeper reason behind that. I know it's hard to take that medicine for 10 days, but there's a reason for that dosage and for that time period. Number 6, ask if you should shower before you have surgery. If you're having surgery, ask if you can shower with a germ-killing soap ahead of time. If they don't give you one, it is very easy to find. They have it at Walmart, they have it at CVS, Walgreens. It's called Hibiclens, which is kind of a chlorhexidine-based antimicrobial soap, and you can use that ahead of time. Typically, if you're going in for surgery, they don't want you to wear any makeup or jewelry, because those things can also carry germs, and we want to create as sterile and germ-free an environment as possible. Number 7, ask each day if you're in the hospital and you have an IV catheter or a urinary catheter, please ask every single day, do I still need this? Because sometimes hospitals are full, it gets very busy. You may not be seen as often as you would like or as often as they would typically see you during that time period. But doctors and nurses are responsible for ordering the removal of catheters. So ask if you still need it and make sure that they're cleaning it properly for you and helping you with that. Number 8, ask about vaccinations that you need so you can stay healthy. Vaccinations or immunizations are an effective way to prevent disease and suffering and healthcare costs associated with vaccine preventable infections. But always question it, especially with the newer ones. I know they're working on a newer COVID booster, but always read about it. There's always pamphlets and information about the vaccinations. The reason why there are so many vaccinations is because viruses do mutate. There's a lot of RNA viruses that are missing a proofreading mechanism, so they're prone more so to mutating than other types of cells and things. Viruses are not cell, they're acellular. So they're going to be more prone to mutate. And they have to guess each year which submonomers they think are going to mutate when they create a vaccine. So make sure that you stay up to date and find out information about them. The CDC.gov, the National Institutes of Health, the World Health Organization are the gurus to go to read for that primary information, which is research backed on the newest vaccines that they have, so you stay informed. Number 9, recognize an infection preventionist. Infection preventionists do partner with your healthcare team to make sure that everybody is doing the right things that they need to keep you safe from healthcare associated infections. And feel free to ask about that when you are in a healthcare setting, clinic, or hospital. And last but not least, number 10, learn about healthcare associated infections. If you are having surgery or a loved one or friend is having surgery, or you're going to be with them, or if you are in the hospital, you're sick, you've been admitted, you have a friend or family member that has, it's important for you to stay educated and find out about healthcare associated infections so that you can get the treatment that you need for medical or surgical conditions. So I will try to be posting more videos over time about different common healthcare associated infections. Most of those, if you take microbiology class, you will learn about those in your microbiology class. There's some that we learn about a little bit in anatomy and physiology, but microbiology is really that core where you will learn more about those specific types of infections. And I look forward to making more videos for you to keep you informed along the way. Have a great day, and it was a blessing getting to share this information with you.